I thought we could start by putting the issue of vaccination and access to vaccine into perspective. So the world's largest vaccine maker, the Serum Institute of India, has just announced not long ago that they can no longer export the Covishield vaccine that it's making on behalf of AstraZeneca because India is going through a crisis right now that has spiraled. Are you concerned that the deadly spike in India is a precursor to what we might expect in African countries, given that the projections for sufficient quantities of vaccines for achieving mass vaccination in Africa is not going to be available until 2023?
I think this is a big concern, not only personally, but I think many people in Africa, many of the thought leaders and the decision makers and the players in the vaccine industry in Africa, those busy with the vaccination programs, health programs, etc. I think we're all unified, seem to be unified on this issue, that it's a major issue, that we can begin to address the COVID-19 situation through the various waves if we have access to vaccines. As we all know, this has been an ongoing challenge, not only for countries in Africa, other regions of the world as well, but I think Africa pips everyone to the post in this instance, where it is so far behind in terms of its immunization coverage. And as I said, that immunization coverage depends on access to vaccines. And we've seen that there have been many, many instances where this has been challenged. There have been many attempts made to put structures in place that would enable access, COVAX being one such example. But again, it depends on the supply of vaccines from different vaccine manufacturers into the COVAX facility. And I think that this issue of the situation with the Serum Institute of India and the company not being able to export product, not only into Africa, but generally speaking, raises a major issue which we as the African Vaccine Manufacturing Initiative have been sounding the alarm for, I think, for the last probably 10 years.
But still on the topic of the Serum Institute, India is not the first country to ban the export of products in this pandemic, not just vaccines, but we've seen bans for other products, for essential medical products needed for the pandemic response in Africa, in other low and middle income countries. Talk to us a little bit about the current state of COVID-19 vaccinations in Africa and how that has impacted people, services, African economies across the continent.
This question intersects with a position that we've held, and that is when we talk about vaccines and the access to vaccines, we're not simply talking about a medical intervention, that we want to address a specific medical issue. We've seen that there's been an intersection in a very direct way between what is a medical situation with respect to the impact of COVID-19, but there's a fallout around that in terms of the way it's been managed. And there have been many debates around that in terms of what should be, what shouldn't have been, are the lockdowns okay, no, they're not okay, and all of that. But fundamentally, when you strip away all of those issues, we have a virus that we've never seen before, that is tearing through countries and populations, leaving destruction in its wake. And so in the wake of this destruction, we are seeing that there are lives lost, there are families left absolutely devastated. But if one lifts one's eyes up from that micro sort of focus and you zoom out a little bit, you also see the macro impact of all of this. And we've seen the indirect impact and the direct impact. The indirect impact being that the economies go into lockdown, and that has a ripple effect in terms of the economic impact. And it's been devastating. Businesses shut down, people losing their jobs, etc. So there's ripples out from the individual, from the family, from the community, into countries as a whole. And so there's an intersection that's brought into play now between what is a health issue and what becomes a socio-economic national security issue. Because when your economy begins to implode, all sorts of things go wrong. And so we have been beating this drum that the way to look at the need for vaccine production capability on the continent is not simply saying, what are you going to make the vaccine for per dose? And what can we buy it for per dose? That we need to be looking at this as an insurance, as a security issue, that access is the important thing. Now, when the sun is shining, as has been the case with respect to vaccines and the ability to procure vaccines, certainly by African countries over the last while, it was a non-issue. Why should we bother? We get vaccines. Those countries who self-procure can buy their own vaccines through a tender system. There is not a shortage of companies who respond to those tenders. And even those who don't self-procure vaccines get their vaccines partially subsidized or completely subsidized by GAVI through UNICEF. So there was what I call a superficial response to this, saying, yes, it is important, but I don't think anyone really understood the urgency of it until now. And so I think the message has landed. I am encouraged by the work of the African Union through the African CDC in galvanizing the different players and at least putting together a coherent vision in terms of driving this forward to be realized sooner rather than later.
So you've been sounding the alarm for the last 10 years. It would be great to speak about some of the hurdles, why those warnings have not been heeded, and the gap between the vaccine doses that can be made and what is needed to make sure that people are protected in Africa and around the world keeps growing. And according to UNICEF, the world is currently 140 million doses short, and that gap is expected to keep growing. Do you think that as this gap continues to widen, we are going to see more countries putting in export bans? What would that mean for countries such as ours and others like us around the world?
While there is a imbalance between demand and supply, I think you're going to always see these forces at play. And I don't think that at this point in time, one can manage that in real time. There's been a call for countries not to do that. But whatever their rationale is, certain countries feel that it's in their best interest to look after their own populations first. And that's another debate and argument. But I think there should be no argument in any of our minds on the African continent that this should become a priority issue for us collectively and individually as countries on the African continent. We need to cater for the worst, plan for the worst, and make sure that we are in a good enough position to deal with that worst case scenario now that we've had a taste for what it could be. And I don't think that we have reached the bottom of the barrel yet. I think things could get worse, and this could be influenced by two factors. The one is the way the virus spreads through the populations in Africa. Thankfully, thus far, it hasn't had this devastating effect that was first anticipated with respect to the African population. But we don't know what lies ahead. We pray and hope that it remains contained to the best extent possible, but we are not in a position to project whether the vaccine supply issue is going to get better or not, depending on what these countries and companies who have the ownership of that capacity and capability might or might not do. But we can't be left here guessing. We should come up with a plan, resource that plan, and drive it forward in a realistic way with a roadmap of actions that feeds back in a positive loop to encourage us that we are making progress to this desired goal.